Bismillahirrahmanirrahim. Quote of the days: you will face many defeats in life, but never let yourself be defeated. Today, the topic of my presentation is relapsing fever. Learning outlines, introduction, epidemiological triad, chain of transmission, levels of prevention, and recent updates. Learning outcomes. At the end of presentation, you'll be able to describe epidemiological triad, prevention aspects, and recent advances. Now, introduction. Relapsing fever is an acute infectious bacterial disease characterized by alternating febrile periods and non-febrile periods. It is also known as recurrent fever or tick-borne fever or louse-borne relapsing fever. It is caused by several species of bacteria in the Borrelia family. There are three types of relapsing fever: tick-borne relapsing fever, louse-borne relapsing fever, and Borrelia miyamotoi disease, sometimes called heart tick relapsing fever. So, tick-borne relapsing fever occurs in the western United States and is usually linked to sleeping in rustic rodent-infested cabins in the mountains. In Texas, tick-borne relapsing fever is frequently linked to cave exposures. Louse-borne relapsing fever is transmitted by the human body louse and usually occurs in refugee settings in developing parts of the world. Borrelia miyamotoi disease occurs in the same places where Lyme disease is found and is transmitted by the black-legged tick. Now, there are two major forms of relapsing fever: tick-borne relapsing fever and louse-borne relapsing fever, and we will discuss these major forms ahead. Now, coming to epidemiology. Tick-borne relapsing fever. It is found in discrete areas throughout the world, including mountainous areas of North America, plateau regions of Mexico, Central and South America, the Mediterranean, Central Asia, and much of Africa. Tick-borne relapsing fever is spread by multiple tick species, each of which had a preferred habitat and set of hosts. Ornithodorus hermside, the tick responsible for most cases in US, prefers coniferous forests at altitudes of 1500 to 8000 feet, where it feeds on tree squirrels. The two other US tick species that transmit tick-borne relapsing fever, O. parkeri and O. turricata, are generally found at lower altitudes in the southwest, where they inhabit caves and burrows of ground squirrels. Louse-borne relapsing fever. It outbreaks most commonly in conditions of overcrowding and social disruption. Louse-borne relapsing fever epidemics occurred frequently in Europe during the early 20th century. Between 1919 and 1923, 13 million cases resulting in 5 million deaths occurred in the social upheaval that overtook Russia and Eastern Europe. During World War II, a million cases occurred in North Africa. Today, louse-borne relapsing fever causes sporadic illness and outbreaks in sub-Saharan Africa, particularly in regions affected by war and refugee camps. It is commonly found in Ethiopia, Sudan, Eritrea, and Somalia. Illness can be severe, with mortality of 30 to 70% in outbreaks. This is a geographical representation. Here you can see that the hermside, which is responsible for louse-borne relapsing fever, it is causing this fever in North America, and rest of the species of Borrelia that are responsible for tick-borne relapsing fever, they are found almost everywhere in Africa and in Central Asia, North America. Now coming to epidemiological triad, agent, host, environment. Tick-borne relapsing fever, the agent is Borrelia recurrentis. Vector is human. Reservoir is human body louse, pediculosis humanus. And the environmental factors are overcrowding and poor hygiene. In louse-borne relapsing fever, the agent is Borrelia hamsai and Borrelia dontoni and other species. And the vector is rodent soft shell tick, and reservoir is soft shell tick, that is Ornithodorus hamsai. In this case, you can see that the ticks acts as both vector and reservoir in case of louse-borne relapsing fever. Sorry, tick-borne relapsing fever. And environmental factors are common in summers, can occur in winters, common in mountainous areas. This is the difference between louse-borne and tick-borne relapsing fever. Louse-borne relapsing fever is caused by Borrelia recurrentis, and it is aggressive disease with high mortality, and it is human specific. It is epidemic, may be seen in refugee camps, used to occur worldwide, but now it is only found in Northeast Africa. And tick-borne relapsing fever, it is caused by many Borrelia species, and it is endemic and accidental disease. It is associated with rodents, and it is found in all continents except Australia and Antarctica. It is endemic and it is found in sub-Saharan Africa. Louse-borne relapsing fever is more severe, but tick-borne relapsing fever is less severe. Its duration is short, but relapses are many. This is the distinguished feature between these two. Now coming to clinical features, symptoms: fever, headache, arthralgia, myalgia, dry cough, epistaxis, gum bleeding. And signs are temperature, tachycardia, hepatomegaly, splenomegaly, petechiae, subconjunctival bleeding, jaundice, confusion, and meningism. These are the clinical features mainly of louse-borne relapsing fever. And this is a typical picture of macular rash found in louse-borne relapsing fever. Now the pattern of fever. Here you can see these are the relapses and emissions in relapsing fever. That is there is a spike, then there is, and the fever goes down, then again there is a spike. Now coming to complications. Complications are congestive heart failure, jaundice, bleeding diathesis, iritis, uveitis, cranial nerve, and other neuropathies. Transmission. Tick-borne relapsing fever is a zoonosis. It is transmitted principally from rodents to humans by the bite of various soft ticks. Louse-borne relapsing fever is a disease of humans that is transmitted from one person to another by the human body louse. Louse-borne relapsing fever is transmitted to man by body lice, which gets infected by feeding on spirochetamic patient. Borrelia reaches its hemolymph and multiply there. The disease, therefore, is neither transmitted by is transmitted by louse bite or by feces. It is acquired only if an infected louse is crushed over an abrasion on skin or mucous membrane. Now, louse-borne relapsing fever is also called epidemic relapsing fever. The reason is that there is no animal reservoir for Borrelia recurrentis. Epidemic transmission typically occurs when body lice spreads extensively in badly overcrowded conditions, such as in refugee camps resulting from war or famine. As the only relapsing fever that causes epidemics, louse-borne relapsing fever is sometimes referred to as epidemic relapsing fever. Okay, tick-borne relapsing fever. Now it is transmission of tick-borne relapsing fever. It usually occurs sporadically. Soft ticks get infected by feeding on other mammalian hosts like rodents. Borrelia invades its all body tissues, including salivary glands and ovaries. Once infected, a tick may carry Borrelia for 10 or more years and even transmit it vertically over several generations. In contrast to lice, ticks transmit disease to humans by almost painless bites. Now, incubation period, tick-borne relapsing fever, the incubation period for tick-borne relapsing fever is 3 to 6 days, and for louse-borne relapsing fever is 5 to 8 days. Now, levels of prevention, that is primary, secondary, and tertiary. In primary prevention, these are the health promotion aspects, that is avoid sleeping in rodent infested building, prevent tick bites, use insect repellents containing DEET on skin or clothing, or permethrin. If you are renting a cabin and notice a rodent infestation, contact the owner to alert them. If you own a cabin, consult a licensed pest control professional who can safely identify and remove any rodent nest from walls and floors. Treat cracks and surfaces in the walls with pesticide. Louse-borne relapsing fever can be prevented by eliminating circumstances that promote louse infection, that is crowding and homelessness. and good personal hygiene. For example, changing clothes at frequent intervals, bathing, boiling, and washing clothes and bedding. Delousing with 1% Linden, DDT powder, or Lysol is useful in shelters and in patients in household contexts. Specific protection. Currently, no vaccine against relapsing fever is available, but research continues. Developing a vaccine is very difficult because the spirochetes avoid the immune response of the infected person or animal to antigenic variation. Now, secondary prevention, early diagnosis and prompt treatment. Diagnosis is made on the basis of dark field or bright field microscopy. The diagnosis of relapsing fever is suggested by recurrent fever and confirmed by visualization of spirochetes in the blood during a febrile episode. The spirochetes may be seen on dark field or bright field examination or right or giemsa stained thick and thin blood smears. Serologic tests and cultures are unreliable. Incidental laboratory findings include normal to increased WBCs with a left shift towards immature cells, mildly increased serum bilirubin level, and mild to moderate thrombocytopenia, elevated ESR, and slightly prolonged PT and PTT. Now, treatment. The antibiotics usually given are tetracycline, doxycycline, or erythromycin. In tick-borne relapsing fever, tetracycline or erythromycin 500 mg orally every 6 hours for 5 to 10 days. And louse-borne relapsing fever, a single 500 mg oral dose of either drug is effective, either tetracycline or erythromycin. When vomiting or severe disease precludes oral administration or when the CNS is affected, parenteral ceftriaxone 2 gram per day for 10 to 14 days or doxycycline 1 to 2 mg per kg IV every 12 to 24 hours may be given. Now there is a term Jarisch-Hersheimer reaction. This is a reaction that is caused as a potential side effect of treatment, and it frequently starts within 1 hour and lasts for 24 hours with symptoms of fever, muscle pains, headache, and a fast heart rate. The reason is that when we treat the patient with antibiotics, there is sudden release of bacterial products. And the cytokines, due to the cytokines, there is abrupt increase in temperature and other constitutional symptoms. Management is supportive care. Control of relapsing fever. There is control of infected persons, contacts, and environment through early diagnosis, notification, isolation, and disinfection. And we do disinfection usually with DDT. Quarantine for 8 days in case of loss-borne relapsing fever. Then epidemic measures, applying DDT to clothes and exposed parts of the body. Then international measures, notification to WHO, DDT spray of planes and ships of infected areas. Pregnancy. The spirochetes can cross the placenta from mother to fetus, leading to spontaneous abortion, premature birth, congenital defects in children, and neonatal deaths. Prognosis. Loss-borne relapsing fever, death rate for untreated cases ranges from 10 to 70%, and in tick-borne relapsing fever, it is 4 to 10%. With early treatment, death rate is reduced. Now, coming to updates about Pakistan, loss-borne relapsing fever appears in an epidemic from time to time in those districts of Pakistan which adjoin Afghanistan, particularly when nomads migrate during winter into Pakistan. And there was a systematic review on epidemiology aspects. According to it, there was it was written in systematic review that investigations in the NWFP led to the belief that both the louse-borne and the tick-borne variety are endemic in these areas, suggesting that careful watch should be kept for sufficient differentiation of louse-borne relapsing fever to tick-borne relapsing fever. The authors noted that the disease is common in the Karachi region. However, their work lacks discussion as to whether these cases belong to the tick-borne or louse-borne relapsing fever. relapsing fever today. This disease still has persistent foci of infection, where control can be a major health problem. Relapsing fever can be acquired by travelers and brought back to regions where the disease is not epidemic after eco challenges or in association with military training or activities such as camping or caving, provided susceptible host and natural disease ecologic cycles coincide. Although many would argue that this limited disease impact is not a threat to public health, the lack of consideration of relapsing fever as a potential cause of clinical findings is a cause for concern. Future prospects. Traditionally, diagnosis is based on demonstration of spirochetes in blood films taken during the acute febrile period, as we discussed earlier. More recently, an ELISA that used the GLPQ gene product was demonstrated to be a useful diagnostic aid. Furthermore, this antigen is specific for the relapsing fever group Borrelia, thus distinguishing these cases from Lyme borreliosis. Characterization of relapsing fever Borrelia species can now be facilitated through molecular approaches that allow more accurate investigation of which species are prevalent in different epidemiologic foci. Now coming to MCQs. Endemic relapsing fever is caused by all except Borrelia dutonii, Borrelia hamsii, Borrelia parkeri, and Borrelia recurrentis. Anyone from the class? The correct option is Borrelia recurrentis. It is responsible for endemic relapsing fever, that is loss-borne relapsing fever, tick-borne relapsing fever, loss-borne relapsing fever. Others are responsible for tick-borne relapsing fever. Okay, while all of the following are common symptoms of relapsing fever, which are considered the most common: headache, myalgias, arthralgias, nausea, vomiting, abdominal pain, sudden onset of fever, chills, malaise with intervening afebrile periods, confusion, dizziness, nausea, vomiting, abdominal pain, uveitis, GIT, bleeding, fever, convulsions.
A. A.
Yes, the main, uh, all are common features, but the most common is sudden onset of fever, chills, malaise with intervening afebrile period. Okay, tick-borne relapsing fever is caused by,
A.
yes, right answer. The standard method for confirmation of diagnosis of relapsing fever is dark field microscopy, serology. A correct answer is A. Non-specific laboratory abnormalities associated with relapsing fever include severe thrombocytopenia, decreased bilirubin, elevated WBCs with immature forms A and C.
C.
Yes, correct answer
A.
is because in relapsing fever there is mild to moderate thrombocytopenia and increased bilirubin. Other are wrong options. Mountain hikers sleeping in rodent-infested caves in the mountain are at increased risk of developing louse-borne relapsing fever, tick-borne relapsing
B.
fever. Yes,
B.
right. Cherish Harsher is caused by increased amount of
B.
spirochetes in blood, cytokines.
A.
Yes, correct. No, correct answer is cytokines released from bacteriolysis. This
B.
reaction is caused due to this. B is correct answer. Which of the following is not correct but tick-borne relapsing fever about tick-borne relapsing fever? It acts as both reservoir and host. Uh, it is vector, reservoir and vector. The disease is less severe than louse-borne relapsing fever. Duration is short, but relapses are many. Duration is long, but relapses are few.
B.
No, correct answer is duration. C. Duration is short, but relapses are many. Which of the following case raises more suspicion about relapsing fever? A person coming from high-risk area has repeated episodes of fever. Person with high-grade fever and painful tick bite mark. A refugee living in a camp with macular rash. A school child developing fever and chills with no travel history.
A.
Yes, A is correct
B.
answer. Laos-borne relapsing fever causes outbreaks most commonly in Africa, North America, South America.
Africa.
Yes, right answer is Africa. Okay, class. Sorry, there was a mistake in my slide. Mm, it is Laos-borne relapsing fever here and tick-borne relapsing fever. In Laos-borne relapsing fever, the agent is Borrelia recurrentis, vector is human, reservoir is human body Laos, and environmental factors are overcrowding and poor hygiene. And here there is tick-borne relapsing fever. It is caused by other species and vector is soft-shelled tick rodent and reservoir is tick. Sorry for this mistake. And here our presentation ends. Thank you.
Thank you, Dr. Meha.
Uh, Thank you. Welcome.